I would have never probably walked if I stayed in this country. The resources necessary for this kind of rehabilitation were just not something that my meager health insurance covered. I think I ran out of the benefits a month or 6 weeks into my rehab. So that pretty much prompted me going back. But, as you probably know, there's blessings in every journey. And it was that going back and having that experience of understanding the sacred contract that we as patients, and this was the first time that I was in that role, make with our doctors at the point of diagnosis or trauma, and the healing that contracts that we create, spoken or unspoken, and what does that mean, and what is going to be eventually my role in that contract.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Our guest today is Ivana Schnur, co-founder and chief medical officer of Sensely, an avatar-based clinical platform that helps physicians better monitor and manage chronically ill patients. Ivana brings a unique combination of clinical knowledge, product insight, and business development to power the transformation of clinical workflows in scalable and compassionate ways. In this episode, Ivana shares her own incredible journey to medicine, from growing up in the Eastern Bloc in Czechoslovakia, moving to the US to become a doctor, to recovering from a spinal cord injury that left her paralyzed, and understanding the potential of virtual reality in medicine. She offers a powerful vision for the future of palliative care, one informed by the sacred contract between patient and clinician. Here's that conversation. Welcome, Ivana. Thank you so much for joining me this morning.
Oh, thank you so much for having me, Christine. It's an honor to be here.
So I thought before we start, if you can share with us your background, the path that you took to get to where you are today. I cannot tell from your accent, but you mentioned that you're from the Eastern European. How do you come about? We're all immigrant here.
Indeed. It's been quite a fascinating journey. I grew up in Czechoslovakia, in Prague. At the time that I was growing up, it was communist. And so it was in the Eastern Bloc, quite locked up and unaware of technology and all kinds of advantages of the modern age. My family has been in medicine for many generations. Both of my parents and aunts and uncles were doctors. So it was assumed that I am going to be a doctor as well. The political regime, however, had a little different idea of my education. So I wasn't really allowed to study in a way that would have been the easiest and smoothest of journeys. At 1989, which seems like a million years ago, when the student revolution happened to overthrow the communism, I was kind of on the front lines of that. So I can't really blame my children these days for trying to be my political activist. I think I gave my parents some really tough times, but it worked out well. We actually succeeded, not because it was all about us, the students, but I think we played a role, and it positioned me for a very different life. Little did I know. And so as I entered medical school, all kinds of opportunities that never existed opened up. And I ended up doing a lot of my clinical studies and work in United States. I won this scholarship to Harvard, as well as then subsequently networked and got into Georgetown and University of Alabama, of all places, for certain rotations and training. And so it wasn't really very shocking for my family when I married my first husband as an American and left the United States to be a doctor here in America. But my life path took a little different journey. I sustained a spinal cord injury about 2 years in, and that left me paralyzed in the wheelchair from the waist down. And at that time, we were a very young family. I had a 3-year-old child when that happened, and it just completely changed the trajectory of my journey. Eventually, when I came back as a single mother, the career of oncological pain management, which is what I've been preparing for and studying, just wasn't possible under those circumstances. So I went back to grad school, and because of the work that I've done in oncology, I started in palliative care, but eventually moved west to Silicon Valley. I didn't know it was Silicon Valley then, and finished my graduate work here. And that was really my first introduction to medical or clinical entrepreneurship. I met through Stanford a lot of professors, including and doctors and scholars. And I started working with one of them, Dr. Walter Greenleaf, and was introduced into the technology that helped me recover all those years ago, as well as using it for completely new and revolutionary work with PTSD and veterans. And it was a VR technology, and it opened my horizons to what we can do. And I'm meaning the clinical, body of nurses, doctors, and how we can change if only we can get out of our clinical training and all these traditions that are dictating sometimes a little too much what's allowed, what's correct. And if we can find that humility to be taught by most of the unusual crowds, like, multiplayer gamers and and our children, then we can do something. And so that led me eventually to what we'll probably talk a lot, and that is Sensley and my role as a co-founder and chief medical officer.
Yeah, and you are a force of nature. I'm sure people tell you that all the time. Maybe I want to understand a little bit more. You were saying that you're in the front line when you're there to protest, do a lot of that. I'm sure your parents were worried about your safety at that time.
Yes, it was a very tumultuous time. And, my parents protested the year I was born, the 2 years, 68 and 69. It was a very little success. And we were under the Soviet occupation most of my childhood and their young adulthood. And so watching their daughter to march onto the barricades at 89 wasn't exactly what they wanted to see, because it didn't end well for them.
Right.
They were not allowed to leave the country. Like the restrictions put on our family were quite severe. And so, yes, there was a lot of demonstrations. There was a lot of protests that, we were very lucky. It ended well because many reasons, but also politically, I think the world was ready for change.
Right.
And so here we are.
It feels like you are taking action to make a change of what you want to see. And I think it carried through with a lot of the things that you're doing subsequently throughout your life.
Very kind. But, I think the one lesson that one took from that, watching our parents and grandparents go through the war and then the subsequent, eras, was that you do have to fight for what you want. It doesn't always mean that you stand on the barricades or that you protest. Sometimes the fight is very quiet, but sticking to your integrity and understanding what it is that you are about and what you stand for is something that we had to learn very early on. It was slightly easier in a sense that, we were confronted by many different ways that tried to curtail our freedoms, but also our integrity. And so you had opportunities to decide what do you want and how you want to live.
And I think the other major, I'm sure, the injury that you have, it changed what you think your future is and how to accept that change and adapt. That took a lot of resilience. And how do you learn to cope with that? If you could share with us a little bit.
I was very, very fortunate. No one is prepared for an event like that. We all live our lives as if none of these events or things really exist. And so when it happens, we are kind of called, our calling card is called, and we need to rise to it. And I won't lie, it was not what I've imagined my life was going to be. And for good 6 months, sitting on that chair, you're just dazed and confused. And somewhere in there, there's a lot of rage and, self-pity. And eventually it comes down to making that decision of, okay, am I going to accept it? Am I going to fight with it? And I'm going to fight with myself, with everybody around me. I mean, you have to take a stance, because even not taking a stance is taking a stance. I had Daniel, my son, at that time, and there was really no decision. I could look at him, and he gave me that strength, and that was extremely important. I also left this country briefly because the medical system that I've met through that experience, including, the most immediate post-trauma hospitalizations, that was such a shock to someone that, I've never been in a hospital until then. My parents are both doctors. I've never really visited doctor's office. The two doctors.
You got the personal service.
Of course, but also, my parents practice medicine in a way that here you have that Norman Rockwell painting of the doctor sitting, at home by the bedside with that little bag. That was my dad and my mother. We practice very different medicine, and I think we still do in Europe. And so meeting it for the first time on the other side of the bed in that kind of situation, it was quite traumatic. And I would have never probably walked if I stayed in this country. The resources necessary for this kind of rehabilitation were just not something that my meager health insurance covered. I think I ran out of the benefits a month or 6 weeks into my rehab. So that pretty much prompted me going back. But, as you probably know, there's blessings in every journey. And it was that going back and having that experience of understanding the sacred contract that we as patients, and this was the first time that I was in that role, make with our doctors at the point of diagnosis or trauma, and the healing that contracts that we create, spoken or unspoken, and what does that mean, and what is going to be eventually my role in that contract. So it was, a huge learning experience. And I think Sensely and what we do now in a very small way is still drawing on some of those events.
It's interesting how a lot of your experience and how you react to it, how you learn, it shape what your philosophy and your thinking as you come up with the innovation and you think about the customer differently because of what you experience. And tell us more about how the journey that you decide on, like, okay, this is something that we definitely need to address, and took the courage to start something from scratch, which takes a lot of another force of nature.
It started really in my graduate work. And that part I as most graduate students just kind of fell into. I mean, I very much was intrigued by technology. I can't really tell you what was it that truly, for the first time, attracted someone that has never used computer game in her life. But probably it was, again, the patient journey. I did meet the veterans and or active military personnel going through these PTSD programs in which you put them into those VR goggles and project them back into combat or post-combat environment. And I watched that physical transformation of the patient from this, massive, relatively scary to me, fighter to someone deeply traumatized. It was, sweats going down their temples because they're encountering something that created that PTSD event for them that is now haunting them. And the incredible capacity of this technology to help them and transform. I was in love. I was absolutely just lost in that potential. And what was shocking to me was the reaction that I would get from my colleagues when I, full of enthusiasm, tried to, share with them what I thought is obvious next steps. And there was very few takers. And I couldn't quite reconcile that. And I understood that you had to put the helmet on and that it was cumbersome. But to me, that North Star of those results was everything. But it wasn't that simple. And all of a sudden, learning that it's not their job to understand, it's my job then to translate. And help them move from, we don't do this in whatever field it is, into being able to consider it. That was a challenge that I accepted. And it was not possible to do it with the VR. I don't think we're still there quite yet for many different reasons. And so when I was talking to many of my colleagues, including my mentors, I said, okay, what is the smallest piece? Where can we start then? Because clearly there has to be a revolution here, a different kind of revolution of thoughts and acceptance of these new technologies. And we came up that maybe avatar, maybe that virtual nurse, that persona that will represent the doctors and nurses and will represent that trust and that sacred healing contract in a way that is acceptable to both parties, the patient and the clinician, is a place to start. And so that's why I chose to do a symptom checker or a clinic, virtual nurse, or those many iterations of Sensely that it has been since this. When did we start? Oh my gosh, 2013. So,
Yeah.
we've gone through many iterations of Molly.
I'm sure. So when you were working with a lot of the PTSD VA veterans, that is your role in the clinical setting, in academia setting? Is that?
So a lot of that was academia. So we worked with the Institute of Creative Technologies at USC, and Dr. Skip Rizzo and Dr. Walter Greenleaf here in Stanford and DOD. A lot of these contracts were with VA hospitals, and most of the clientele was active or military personnel or veterans. And there were several companies that spun out of that. One of them was Virtually Better, that created the game Virtual Iraq and Virtual Afghanistan. Game, in parentheses, it's a therapeutic software. I believe it's still being used. It still has not kind of reached the commercial capacity that we all, wanted. But some of the development in our hardwares and stuff is just not as quick as we would like. And then we took that same concept into adapting it for social skills, addiction, and sort of the mental health diseases that are helped by this kind of interaction. We created my first startup. I didn't even know what startup was. I didn't even know that I am allowed as a clinician to be an entrepreneur. And it was called InWorld. And that really taught me everything that I, had about business and the intersection between being a clinician and an entrepreneur, and gave me a vision of what I can dream about. Like I didn't even know I was allowed to, cross discipline. I grew up in a very structured environment.
Yeah.
And so it gave me freedom.
It's interesting. Sometimes the exposure, knowing that's what's possible, open your eyes and you can leap into creating the opportunity. I think it's amazing how we need other people to inspire us, right?
Absolutely.
This podcast is sponsored by Brown Rudnick's Global Life Sciences Group, a team of legal professionals that help life science companies, lenders, and investors around the world turn good science into good business. Learn more at brownrudnick.com. This podcast is also sponsored by Canon Quality Group. Canon Quality Group has been helping medtech startups set up quality management systems for over 10 years. If you're unsure when to get started with quality management in your startup, turn to the experts at canonqualitygroup.com.
So, you briefly touched on the beginning. I just want to make sure our listener understand what is Sensely trying to achieve, what it does, and where you guys are in terms of the stage of the company.
Brilliant. So I've met my co-founder, Adam, in one of those startup environments where we both were doing presentations about our respective projects. And when I saw what became Sensely, like his concept of a virtual doctor or virtual nurse that talks to you, you can talk back, I was immediately captured. And so when through circumstance and serendipity, my project ended and his didn't begin. We put it together and created this vision of creating a virtual nurse, an entity that has an avatar presence that can talk and listen to you, and become what now we would call the clinical concierge. It is that presence that can take you from what it is that you need to where you need to be it a doctor's appointment in 3 days, be it urgent appointment right now, knowing where the testing sites for COVID are, understanding, the symptoms of diseases, and or wellness, work that one can do after assessing, where one is and then work on your sleep. On the other spectrum of that, monitoring your chronic heart failure every day through devices and targeted questions. But the red line that goes through all these use case scenarios is that trusted clinical assistant that has capacity for empathy, and it fosters that trust that exists and that I keep going back to between the real clinician, the real life clinician, and simulates that. And so it's this proxy that is sitting there for the patient 24/7. And now with our experiences through the pandemic, none of us doubt that, it is necessary. And so it's creating this intermediary that you can trust, speak to, or text with, depending on what you need. And it's going to take you where you need to be.
So in order for this system, the platform you call, I don't know what you call it, you probably need to connect with a lot of the patient information and connect it with the providers. And how do you achieve that?
So it's a platform. It has those two interfaces. One is for the patient, usually through an app, of some sort. And then, as you correctly said, it does integrate on the back end with the clinical provider or the insurance company. We now work far more with insurers or insurer providers like Kaiser Permanente, where they take that last mile and connect it. Initially we started in many different use case scenarios. Our completely initial start was in mental health and then in chronic diseases. And we all can understand that we need a patient to be under clinical observation for many different diseases. It's too expensive. It seems a no-brainer that the technology can do that. You do, on the other side, on the clinical side, need to provide a portal or some kind of dashboard for your clinicians that then they can quickly act upon, and it makes their clinical efficiency much higher. And that is remaining one of our use case scenarios. But through discussions and deployments with our partners, medical providers and insurers, we found an opportunity that was even more pressing. And that is most of clinical care and primary care until now still works on first comes, first served basis. So when you're feeling ill, especially if you consulted Dr. Google the night before, in the morning you'll feel much worse, and you want a doctor's appointment, and you're going to start calling or going online to find that first possible appointment, that because you feel the urgency to be seen. And as much as we would all like to be accommodated, it is really not practical or clinically wise to do that. And for our clinicians to not feel burned out, etc., it is much better if we work based on clinical urgency versus who comes first or who called the loudest. And so creating a symptom checker or some type of triage that's digital, and that stands between the patients with the clear goal of obtaining a visit and the clinician that qualifies that visit for both, gives the patient a peace of mind saying, I can hear what's wrong with you. I think this is the urgency here. I'm going to connect you and make that appointment within that urgency. Provides the patient a peace of mind because they know that the provider has listened. They do have their complaint registered, that they can come back if it gets worse and increase the urgency. And on the other side, the providers, the doctors and nurses that need to be seeing those patients know, and again, have their own peace of mind from a clinical efficiency. They are seeing the patients that need them the most, the earliest. It involved a lot of work with the providers, understanding how to integrate, with what to integrate. I wish we would have all those months and years back of the, dead ends. But we got there in the end, and we continue to work with, NHS, the National Health System in England, where we have, several millions of people actually using app called Ask NHS, doing exactly that. We are fully integrated into the medical record. So it's really nifty because that clinician, eventually opens the portal and sees all the questions asked, all the answers given. They don't have to ask the patient the same questions again and again. And it's just improving the channel shift that we are trying to achieve from those really expensive emergency visits or even urgent care visits that were necessary from the patient's perspective. They needed that reassurance, but they were really not indicated from the clinical perspective. The appointment with the GP 2 days later would have been just fine. And so it's really exciting to see that. It's exciting to see the COVID environment changing that perspective of the providers that really were just not quite into telemedicine, kind of bringing that in and now working with much larger companies like huge insurers like Allianz and AXA and AIA and Zulik to bring this technology even further.
Yeah, I mean, you mentioned earlier about your platform is used at Kaiser. I mean, you mentioned earlier about those are some of the value proposition for a company like Kaiser. How does this reflect in the fee for service world? And I know it's kind of going towards the value base, but how does that help them?
It was a huge struggle for us. Kaiser, because is a very unique institution. They're insurer as well as a provider. And so for them, similarly to NHS, conserving resources is extremely important. They don't get paid the way some other institutions do per visit or per emergency visit. And so our objectives were aligned there. So our program for CHF, for chronic heart failure, is quite a success because it reduces those emergency visits. It keeps those patients safe with two nurses versus 4 or 5 nurses that would otherwise have to man a platform of or the cohort of those patients. And that is really important. Our capacity to penetrate the other world, clinical world, where fee for services is a major player, is much harder. The proposition doesn't quite work the same way. It is changing now, and COVID and the pandemic helped to bring use cases up not in chronic care, but in acute primary care to bear that before were much harder to see. And so we kind of come back to it from more of the consumer angle, where patients are now demanding to be seen online and virtually. They don't want to drive to any type of clinical facility if they don't have to. And because for so many months it was the only way to obtain any clinical care, the providers are changing and they're forced to change. And so we will see in the subsequent months and years how it all shakes out. It's not that simple. That business equation, unfortunately, is always present there, and it's not an easy task for those institutions to reconcile that. But I have a huge trust that this experience taught us enough to allow some of these advantages of telemedicine and digital tools to stay.
And I think definitely the government with the Medicare, they definitely look into try to come up with the star quality system that's, again, trying to, provide quality care with the more efficient. So that's something, that's another way maybe that force kind of help move towards that direction. But I know I'm running out of time. I have so many things that I want to ask you, but I thought before we let you go, if you can share with us, what are the 3 lesson learned, that you can share with us from your journey of starting Sensely or life journey? You have so much to offer.
Oh, thank you. I'm going to do my best to put it into those 3. One, there's so much to learn and so much to do, but I think one of the most important lessons for me it remains that respect for the sacredness of human condition, and that sacred contract between doctor and a patient, or patient and a clinician, to broaden it up, and how tremendous of an honor it is to be part of that interaction, and taking that into every little aspect of technology, be it the voice that meets the patient, the syntax where we have, PhD linguists help us with that, the empathy that it will bring, and understanding how little we understand about who is on the other side. And then the best we can do is to offer sort of our empathy and our heart yes, we have to marry it with skill and craft, our 10,000 hours and with the business model. None of this will work if it is all just sentiment, but it has to be anchored for me in something deeper like that. Second is to really have courage, and go for it. It's taking me 30 years to celebrate the failures. I have not been raised in a ecosystem where failing was okay, and yet watching my 5 children sometimes fail colossally and pick themselves up and create something new and fabulous out of it is probably one of the biggest joys of my life. And thirdly, honor your relationships, learn from each other. When Adam and I met each other all those years ago, we never probably would have imagined the different lessons that each of us is going to teach the other, about ourselves, about the business, the things that we were absolutely 100% sure we were right, we were proving wrong. The things that we've never thought were possible happened in the good ways and bad ways. But having that, and I'm really lucky and grateful that I have a partner that we created that respect, and even if we violently disagree with each other, we use it to get better, and we are constantly getting better. And through that, attract other people that are helping us based on the dreams and visions that we have.
Well, that's great. Well, thank you so much for sharing your story and your insight. And I learned so much from you today.
Oh, thank you. You're very kind.
Thank you for listening to another episode of the Health Technology Podcast. We want to thank our executive producer, Herminio Neto, our content writer, Kelly Muscat, and our podcast engineer, Andrew Rojek. If you enjoyed this podcast, be sure to subscribe and leave a review. The Health Technology Podcast is available on all major platforms.